Hello there. Welcome to my show, COVID-19 Update by Heerak. It's November 11, 2020. Happy Veterans Day. Today we celebrate the service of U.S. Army, U.S. Air Force, U.S. Navy, U.S. Marines, U.S. Coast Guard, U.S. Space Force. Um, Yeah, so we have a lot of happy celebrations today for those who serve the U.S. military. If you're a high school graduate, it's not a bad idea to join the U.S. military because it's a job in a way, right? You join the U.S. military at 18 years old, right out of high school, you start getting paid. Um, they give you food, they give you housing, and then they give you a salary and you save up, and also they'll pay for your future college. So it's a good deal, and then they'll keep you physically fit in COVID-19, um, and they have strict COVID-19 protocols. All the soldiers like within their barracks. So if there's like nobody with COVID-19, it's not going to spread anywhere inside the army barrack. So yeah, it's probably your best bet right now because Dr. Fauci says COVID-19 is at least until end of 2022. As you know, I'm running for U.S. Congress in Virginia's 8th District for November 8th, 2022, 2 years from now. So from now until November 8th, 2022, COVID-19 will be with you every day of every week for 365 days a year for 2 years. Yes, that's what Dr. Fauci is saying. I agree with him, but I think it's going to be much longer. COVID-19 will be like decades. So yeah, you're in this together forever. You know what I'm saying? Um, yeah, so I mean, you gotta take things that are happening with a dash of humor, because it is tragic. It is so tragic. You have to create a mental space to survive COVID-19. You know what I'm saying? Psychologically, mentally. Um, yeah, it's going to be horrific. I mean, we have 6 more months to go of the flu season. And we're going to have anywhere from 3 million people die in America to 30 million people die in America from COVID-19. So if we have 60,000 people die in America um, per state, every state has 60,000 people dying, then with 50 states, we will have 3 million people dead by June 2021. And I think you will agree with me that that's an easily achievable number, 60,000 deaths per state. That's only 10,000 deaths per state per month on average. England, United Kingdom, in the month of April alone had 40,000. New York City in the month of April alone basically had 30,000 deaths, just 1 month. We have 6 months to go, and deaths are beginning to spike up. So, yeah, you can see, a lot of people are going to die. Yeah, we had 1,240 people die in the last 24 hours from COVID-19. Um, so we are at 240,838 COVID-19 deaths. Death rate is 2%, but it's going to go up all the way to like 10% or more because during flu season, you're going to have a lot of people dying. And there are other factors that will increase the death rate besides the fact that it's a flu season. Um, and we'll talk about it a little bit more later. In terms of confirmed cases, we have 10,372,481 cases. So in the last 24 hours, we had about 100, 130, 135,000 cases, or over 130,000 cases. So in the flu season, we're going to have like 10% or more death rate. So that's going to end up with a death rate of about 13,000. because we have 130,000. 10% of that is 13,000. So in one day we have 130,000 cases. 10% of that will die, like, so on average 13,000 per day. But the cases will increase. So as you know, we have a Thanksgiving coming up in a few weeks. And that's going to spike up probably over 200,000 cases per day. After that, we were averaging around 70, 80,000 before Halloween. And I've called on Arlington County government, Fairfax County government, Falls Church City government, and Alexandria City government to ban Halloween parties and trick or treating this year. They didn't do it, unfortunately. And that was the case throughout America, all 50 states. So before Halloween, we had like 70,000 to 80,000 cases. After Halloween, just 1 week later, as I predicted, I was right, it spiked up. So now we are averaging about 130,000 cases. So daily cases increased by 50%. So we had like 70,000, 80,000 cases. It grew by more than 40,000 to 130,000. So more, it grew by more than 50%. So we're going to jump another 50 to 100% after Thanksgiving. So right now we're averaging about 135,000 cases per day. After Thanksgiving, we'll probably have like 250,000 cases per day. Um, and dying at 10% death rate, we're talking about 25,000 Americans dying every day, probably sometime in December. Um, yeah, so that's coming. We have 5,000 people die in April per day, but our cases were not very high per day. And COVID-19 wasn't everywhere in all 50 states. Right now, COVID-19 is in all 50 states, and every city is seeing spikes going up. So whereas we had like 30,000 die in New York, we didn't really have too many spikes elsewhere because there just wasn't COVID-19 spreading around in America that aggressively. But everything is very, very different now. Now we're talking about COVID-19 everywhere in every city. You can easily have 30,000 die in New York. I mean, 1 month of April, they had 30,000 die. So every major city, St. Louis, Missouri, Indianapolis, Indiana, Detroit, Michigan, Chicago, Illinois, Los Angeles, California, San Francisco, California, San Diego, California, um, Miami, Houston, San Antonio, Dallas, Texas, um, Phoenix, Arizona, Atlanta, Georgia, Philadelphia, Pennsylvania, New York, New Jersey, Boston, Massachusetts. You get the point, right? We're going to have massive death. So we can easily have 60,000 deaths per state on average. And so we can easily have 3 million deaths by June 2021. That's very unfortunate, but that's very, very likely. And I think more and more scientists are beginning to see that I'm right, and they're beginning to come to my position. I use all different fields, not just science, but social science, Jewish studies, history, different fields to analyze the data. Uh, Obviously, numbers don't lie. We have large number of cases. And Dr. Fauci used to say, well, not many of them are going to die or be hospitalized, but he was wrong because we see a lot of people getting hospitalized. So again, Heerak Christian Kim was right. Dr. Fauci was wrong. And not Dr. Gupta, but Dr. Sanjay Gupta in CNN also says it's not going to be that bad because the cases are milder this time, but he was wrong too. Now we see all these hospitalizations. So Dr. Sanjay Gupta in CNN will come to my position. Dr. Gottlieb, former FDA director, will come to my position. Um, Director Han of FDA will come to my position. Dr. Redfield of Center for Disease Control will come to my position, because I'm right, and their predictions were wrong. Because I use a lot of expertise in healthcare systems, in education, in in Jewish studies and history and other expertise. I have many other expertise areas. to analyze the data, so I analyze at a superior level. So I tend to be more accurate than the majority of the people out there. I am the Leonardo da Vinci of 21st century, and my predictions show me as correct. I predicted COVID-19 is 365 days a year virus. I was right. I predicted that COVID-19 will kill thousands in the summer. My prediction was correct, right? And I predicted that we were going to have hospitals fill up, and they're already filling up. And we're just beginning. We're not even one fourth through the flu season. We're like in the very beginning of the flu season. So you can imagine how many people are going to die this year from COVID-19. I'm predicting 100 million people around the world, minimum by June 2021. And in USA, 3 million to 30 million. So that's my prediction right now. And obviously, millions are going to die in England, Scotland, Wales, Northern Ireland, France, Germany, Italy, Spain, Belgium, different countries in Europe. You're going to have millions of deaths too. So all adding up to about 100 million deaths. You see photos of my friends from my Cambridge days. I lived in England for 5 years at Cambridge, in Cambridgeshire, um, in the United Kingdom. And Prince William and Kate Middleton are called Duke and Duchess of Cambridge, right? Um, that's one of their titles. Um, yeah, so I enjoy my time at Cambridge. I have now with the royalty and nobility of Europe and around the world. And I got to meet a lot of important people. Become friends with them. They wanted to meet me because I'm the Leonardo da Vinci of 21st century. Um, yeah, so I had a great time. My best friend was Martin Wood. You see me right there next to this video. And below that, you see me with Martin Wood and Chris Jackson. He's like, nobility. I think he may be royalty even. And, you see me with photo with Chris Jackson there. And then, my friend who's kind of like a nobility, he's in Austria, but he's, connected to English royalty and nobility. And then, I had some Italian nobility friends that I have two photos with there. And my German royalty friend, Prince Freiburg. Yeah, so, I had a great time, I share a lot of photos with me with, my dates from Cambridge, like royalty and nobility. And, but, it's not like just like hang out with girls, I had a lot of male friends, I'm like men's man, guys like me and look up to me and see me as an alpha male. Yeah, so, you see my buddies there. Yeah, guys like me, wherever I go, guys like me, they look up to me, they want to spend more time, but I'm like, hey, if I have free time, I'd rather spend it with a woman, you know what I mean? I'm like, I don't want to be like, I do it once in a while, like sit around with a bunch of guys watching soccer or football for hours, but you live only 100 years. I feel like that's not as productive as spending time with beautiful women. You know what I'm saying? But anyway, yeah, but anyway, I'm a man's man, I have a lot of male friends. But yeah, I generally am a leader of men, like wherever I go, I kind of, since I'm an alpha male, wherever I go, wherever I am in the men's world, I generally are like at the top of it because I'm the alpha male, and other males kind of recognize me as an alpha male and they kind of instinctively follow me. So that happened to me when I was in Israel, with all my friends being 100% Jewish or Israeli, I'm not Jewish, but I'm like the alpha male there. That happened to me in Cambridge, and I'm not royalty or nobility or a billionaire like all of the people that I hung out with. But I become an alpha male there. Wherever I go, I become an alpha male. When I was at UCLA, you could ask anybody at UCLA who knew me. You could ask Reverend Michael Mutosian. He's a Orthodox Presbyterian church pastor that I kind of encouraged and discipled we're best friends, so we encouraged each other, But he became an Orthodox Presbyterian minister, and I was the best man at his wedding. Yeah, wherever I am, you could ask Michael Lovano, my buddy from uh, UCLA, who's a professor of Roman history, ancient Roman history at St. Norbert College. He was department of he may still be department chair of history and classics at St. Norbert College in Wisconsin. But anyway, yeah. So I mean, you could ask anybody. I mean, I was like the alpha male. Wherever I go, I am the alpha male. It just that's who I am. And it's like it's kind of like imprinting. I don't know if you've seen like Twilight. What do you call that? Is it Twilight? What do you call that? Imprinting ideas that you see in like movies of Dracula movies or not Dracula movies. What do you call that? Wolverine kind of. What do you call that? Not Wolverine. Werewolf. Werewolves. You have the imprinting concept. And, there's all animals have like this kind of male dominant situation that kind of exists. But wherever I go, it's like an alpha male. Um, and it's there's an instinctive element to the males. So yeah, you can become a leader. That is always possible. But some people are born with alpha male characteristics. That it's like ingrained in their DNA. You know, um, and so it's ever since I was little, I was always an alpha male. Ever since I could remember at age 4, I was an alpha male. Um, yes, I mean I think I'm a born leader, but I also acquire leadership skills. But yeah, I try to use my power for good. All this soft power that I have, going for me. Yeah, I try to use it for for good causes, for the common good, to advance people's welfare. Um, yeah, I try to do a lot of good. People know me as a good guy. I remember Odina Schulzen. She was one of the she was yeah, she was one of the Raoul Wallenberg scholar at the Hebrew University of Jerusalem. There were 10 of us. And she used to call me like Tzedek, he's a righteous guy. That was like my nickname. And Adina, she's like modern Orthodox. She went to Ramaz. It's like a modern Orthodox Jewish school in New York. It's an exclusive school, like Philip Exeter for like Christians. Um, yeah. Um, yeah, what can I say? I have a good reputation wherever I go because everybody see me as a good guy. Yeah, but anyway, yeah, what can I say? I am a good guy. What can I say? People like me. Um, yeah. So there are 5 top choices for Latin America. So Brazil is number 1 at 5,699,005 cases at 3% death rate. So death rates beginning to go up in Latin American countries. 162,802 deaths. Argentina, look at that. All of them are like death rate is going up. Argentina, 1,262,476 cases at 3% death rate. See, all the death rates are above 3% now because their death rates are going up. 34,183 people have died in Argentina. Colombia, 1,156,675 cases at 3% death rate. You have 3,312 people who have died. In Mexico, you have 978,531 cases, and you have 10% death rate. I say it's all the dope in Mexico, marijuana, methamphetamine, they're produced in Mexico. Obviously, someone has to produce them. And because it's produced in Mexico, there's probably higher consumption than other Latin American countries. So it's reflected on the higher death rate. So 95,842 people have died. I mean, evidence-based research shows that people who use marijuana have higher chance of dying from COVID-19. So yeah, yeah, doing any kind of dope or drug. I mean, you're messing with your body system. It's not smart. Peru, 925,431 cases, and you have 34,992 deaths. So 4% death rate. So I'm calling Latin America the continent of death. Because you can see the numbers, all top five countries have over 30,000 deaths. And Brazil has like over 162,000 deaths. And Mexico is almost at 100,000 deaths. So Latin America is by far the continent of death. And I'm predicting that at least 1 million Latinos in America will die before June. Yeah, at least 1 million. And if we look at what happened in April, May, and June, and in the summer, a lot of Latinos died from COVID-19 in every state. So I think I'm being actually conservative. It could be far more than 1 million Latinos dying by June. But in certain cases, you had whole families dying, Latino families dying. Yeah. Yeah, so it's going to be very, very tragic. Next few weeks, you'll see tragedy happen in Latino heavy concentration communities like Arlington. You're gonna have a lot of people die in Alexandria, in Virginia. So yeah, if you're Latino, you're very vulnerable to COVID-19 death. Look at the home countries you came from, like Brazil, Argentina, Colombia, Mexico, Peru. So it's kind of expected. It's sad, but we gotta deal with the truth. I'm not gonna lie to you, because you need to be more cautious if you're Latino, because there's a higher chance of COVID-19 death if you're Latino. You know what I'm saying? You gotta know who's more at risk, right? If you know you're at more risk, you're gonna be more careful. That's why truth is very important. Because truth will set you free, right? If you don't have the truth, you may not be very careful. You may end up dying from COVID. That's why I don't believe the liberal media. Liberal media hides the fact, hides the truth. Yeah, so today's title is COVID-19 USA. Crisis panic hits USA hospitals as they hit full capacity. USA hospitals are beginning to hit 100% capacity. 100% meaning hospital is completely packed. There's no room. Like not a single bed is left for a patient. Yes, it's hitting capacity now in many hospitals in America, and it's only November. It's only November. Think about it this way. We have November to go, because we're just in the beginning of November. We have December to go, and the Christmas is on December 25th. I'm predicting that by December 25th, at least 10,000 nurses will die, because about 50 days exist from now to Christmas, right? And so once the death starts taking, who do you think is going to die in large numbers? In some areas, 25% of all COVID-19 cases or deaths are nurses or like healthcare workers. Yeah, so I think I'm being very conservative with the figure, very low with the figure. When I say 10,000, it may be far more than that. I'm predicting that at least 12 nurses will die in Virginia Hospital Center. At least 12 nurses will die in Innova Fairfax Hospital by Christmas. At least 12 nurses will die in Innova Alexandria Hospital by Christmas. At least 12 nurses will die in Georgetown University MedStar Hospital. At least 12 nurses will die in George Washington University Hospital. At least 12 nurses will die in Children's National Hospital. It's a pediatric hospital in this area. At least 12 nurses will die before Christmas. Because now, a lot of children can get COVID and die. I'm predicting that we're going to have thousands of children die in Virginia from COVID-19 before June 2021. And that's going to be the case with every state. We're going to have thousands of children die from COVID-19 in every state. So, you got to be prepared to bury your children, um, you know, from COVID-19 death. It's a global pandemic. If your child gets COVID-19, then your child can die from COVID-19. So you should be prepared for that if you are a parent who has children, because yeah, this year a lot of children will die from COVID-19. And Sibley Hospital, which is a Johns Hopkins University Hospital network in Washington, D.C., there's going to be at least 12 nurses dying there too. And then Suburban Hospital, which is in like Maryland, which is also Johns Hopkins University network, you're going to have so many people die, but in that area, because Montgomery County, that area is a COVID hotspot. But minimum 12 nurses, probably far more than 12 nurses will die there. But anyway, so we're going to have a lot of nurses die before Christmas. I'm talking about before Christmas. There's going to be far more nurses dying from Christmas to June. Right? We're just talking about until Christmas. So we have November, December, and then we have January, February, March, April, May, June. So we have like 8 months to go. But about 6 of those are like, you have flu floating around. So, you can have death from COVID. You could have death from influenza A. You could have death from influenza B. You could have death from like mononucleosis. You could have death from common cold. You could have death from RSV virus. You could have death from all kinds of other things, right? I mean, you could still have death. There's still heart attacks going on. You could have death from heart attack. You can have death from cancer. We have 1.8 million people get cancer every year. New cancer patients. All 1.8 million people can die because they're immunocompromised. Yeah. Because generally, when there's no COVID, about 50% or more die within 2 years. But with COVID, 100% of the 1.8 million cancer patients can die. 100%. That's just in 1 year. Like 2020, we're going to have 1.8 million people with cancer newly diagnosed. 2019 and 1.6 million to 8 million newly diagnosed cancer. So in 2 years, you have like almost 3.5 million cancer patients. All 3.5 million patients, cancer patients can die. Do you see what I'm saying? So it's very serious. You see why I'm saying we may have more like 30 million people die? Just look at the cancer patients in 2 years, 2019 cancer patients, 2020 cancer patients, we can have 100% of them die. That's 3.5 million people already. Do you see why we can't have 30 million people die? Yeah, that's definitely possible. Because and there are a lot of people who are immunocompromised who can die, who don't have cancer, who have other illnesses. So yeah, so I think it'll be more like 30 million Americans who will die by June 2021. So that's my prediction. But minimum 3 million, but more like 30 million Americans will die. I mean, that's only like 10% of American population. 90% of Americans will still be alive. But still, I think I'm being very conservative and very, very, generous with my numbers, meaning, 300 million Americans will live. Only 30 million will die. You know what I'm saying? Comparatively. Yeah, I mean, we gotta deal with reality. I know the fake media, liberal media wants to like make it sound like you're gonna all survive COVID-19. Did everybody survive COVID-19? No, 260,000 Americans have already died from COVID-19. So I don't believe the liberal media keep saying that you're gonna survive. You're not gonna survive. Well, some of you survived, but some will not. Let's not lie. Yeah. First article for today is with North Dakota hospitals at 100% capacity. See, one state, hospitals are 100% capacity. Burgum, the governor, announced COVID-19 positive nurses can stay at work. Is it crazy? COVID-19 patients will spread COVID-19. So nurses who don't have COVID-19 will now get COVID-19 from their coworkers who are at work. This kind of stupid, idiotic decisions will kill more people. We could have death rate of 20, 30, 40% in North Dakota because of idiotic decisions like this by politicians. And this article is by Jeremy Torley, Grand Forks Herald. And the significant quote is this: in an attempt to alleviate some of the staffing concerns. So they're like, oh, we're short of nurses because 100% of the hospitals are packed, right? So they're panicking, right? Everybody in North Dakota is panicking. Everybody in North Dakota who are politicians, administrators are panicking because they know without the staff, these patients are going to die. So if you have 1,000 people who have COVID, a normative 10% flu rate, flu season death, you have, 100 of the 1,000 die. But when you're short of staff, you may have 300, 400 out of 1,000 die. You see what I'm saying? So I understand why they're beginning to panic. Not beginning, they're actually panicking, right? I understand that. But the panic is producing decisions that's going to cause more death. That's a serious problem right now in North Dakota, but panic is spreading everywhere right now. Right now, November 11, 2020, you may not see panic in your room, but panic is spreading everywhere right now in hospitals. It's spreading everywhere in hospitals among like CEOs, presidents. They are panicking because they know they're headed to massive number of deaths. This is happening in all 50 states right now. There's panic, panic, panic. You don't see it because you're the little guy. You're just watching your TV, surfing the internet, playing video games at home. So you don't see the panic yet because these panics are going on in the boardrooms of CEOs, CFOs, COOs, chief medical officers, chief nursing officers, the top people in hospitals who are crunching the numbers and seeing that their hospital is going to have massive number of deaths. They're predicting, like in month of November, our hospital is going to have tremendous number of COVID-19 deaths because of the staff shortage. So they're panicking. You don't see the panic because you're the little guy watching the TV at home, just kind of, picking your nose at home or whatever. So you're not seeing the panic of the leaders in hospitals who have knowledge of the figures, have facts and figures, right? So they're panicking now. So you're going to panic too. That's coming. The little guys in the living rooms watching TV, you're going to panic too. That's coming. But you don't panic because you don't have all the facts and figures, right? You don't see that hospitals in your city are going to certain death of massive numbers of people. You don't see that yet because you don't have all the facts and figures yet, right? Obviously, if you have all the facts and you are prepared mentally and you prepare beforehand, you're not going to panic and you're going to be able to make logical decisions. But because fake media kept telling everybody everything's going to be okay, not too many people are going to go to hospital. This time around, COVID-19 is mild, not too many people are getting sick, blah, 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 blah. You know how the fake media lied to you? So people are unprepared. CEOs were unprepared. Chief medical officers were unprepared. Chief nursing officers were unprepared. And now that suddenly it's hitting them, COVID-19 is sending people to hospitals. Hospitals are completely packed. And so they were not prepared. That's why they're panicking, because they didn't prepare. Had they watched this show, COVID-19 Update by Heerak, and listened to my analysis and all the numbers and facts and figures, and listen to the predictions that I, Heerak, independent candidate for U.S. Congress in Virginia's 8th district. I may run as a Republican. I'm still considering. So, I have 2 years to solidify, but I'm currently running as an independent, conservative independent. Had they watched this show every day, they would have been prepared. They wouldn't have to panic. But they didn't see this show. Do you see why it's important for you to tell everybody to watch this show? Because they need to be prepared so that they don't make stupid decisions out of panic that will result in more people dying. Parents can make stupid decisions that could result in all of their children dying from COVID. Do you see what I'm saying? This is why you need to watch this show every day religiously. This is why you need to tell everybody to watch this show. It's in your interest to protect this show. so that you can watch this show every day and get expert analysis from the Leonardo da Vinci of 21st century. Anybody who tries to destroy this show is enemy of the people. They are the enemy of the people. They're your enemy because they don't want you to get the facts and figures, right? They want to cover up the truth. They're your enemy, right? It's your interest. It's in your interest to make sure this show is continuing and making sure that this show shares the truth with everybody, right? That's in your interest. But obviously, you're going to have all these corrupt people, who want to destroy the truth. That happens in every society. So obviously, you got to play your part to protect this show so that you can get facts and figures and your loved ones can get facts and figures so you don't end up dead from COVID by June 2021, right? Only truth will set you free. So it's in your interest to protect this show, but you have to guard your own interest. At the end of the day, your life belongs to you. Your children's life belongs to you. You're responsible for them. Yeah, so let's keep reading the article. Yeah, so this Governor Burgum announced that the state health officer has amended or changed an order that will allow healthcare workers with asymptomatic, like they have COVID, but they're not showing the symptoms, cases of COVID-19 to continue working in hospitals. This is crazy because we know asymptomatic COVID-19 patients can spread COVID to people. So if you have nurses working with asymptomatic COVID, and COVID-19 is airborne precautions, it lingers in the air, then asymptomatic nurses, when they talk or cough or eat lunch or whatever, have these COVID spreading around in the room, and others who don't have COVID will eventually catch it because of them. Patients will catch it because of the patients who don't have COVID. So they're saying that they are going to let them work in hospitals in COVID-19 units. But COVID-19 units have other staff who don't have COVID, like nurses, patient care technicians, CNAs, respiratory therapists, physical therapists, doctors. Why should they get COVID because of this asymptomatic nurse who continues to work in a COVID unit? You see what I'm saying? So, North Dakota is like trying to seal its own death fate by doing what they do. But actually, you cannot blame this governor. Because look at what comes, right? The Republican governor said hospital administrators asked the state to take the extraordinary steps. So he's like being a pilot, I wash my hands. He's like these hospital administrators, hospital CEOs, hospital chief medical officers, they're telling us to do this, so we're just going to do this. So he's washing his hand. He's washing his hand of all the COVID-19 death that's going to come to nurses and doctors in these hospitals because COVID-19 nurses will continue to work, right? Because hospital CEOs want to require nurses to work, right? Nurses who have COVID-19. Nurses who have COVID-19, even if asymptomatic, has to stay home, right? To make sure that they recover, make sure they don't infect other people. It's a serious problem. Panic has hit nursing administrators, hospital administrators, medical administrators, and that's going to cause exponential growth in deaths. You see why we can have 30 million deaths by June? Because panic has already hit, and it's only November. We have November, December, January, February, March, April, May, June to go. Yeah, we have like 8 months to go. 6 more months of flu season to go. Second article, hospitals at full capacity in parts of Wisconsin amid COVID-19 spike. And the significant quote from that is, hospitals in northwestern Wisconsin are at 100% capacity. Officials said 100% capacity. 100% capacity in parts of Wisconsin already, and it's only November. We have November, December, January, February, March, April, May, June to go. So you see how many people are going to die in Wisconsin. You see it. The simple math, right? You see they're going to die. A lot of them are going to die from COVID-19, right? You see it, right? So hospitals in northwestern Wisconsin are at 100% capacity, officials said, as the state continues to battle a record number of COVID-19 cases and deaths. The Mayo Clinic Health System, Virginia Hospital Center, where I work as a registered nurse, is a part of the Mayo Clinic network. So the hospital that they're talking about in Wisconsin is the Mayo Clinic Health System, which operates hospitals in the region encompassing Barron, Broomer, Eau Claire, Osseo, and Menominee. Said all their beds were full of Tuesday afternoon. That's yesterday, right? Today's Wednesday. All their beds were full, according to WQOW. 83 of its patients had COVID-19. So, I mean, all the beds are full, and then 83 of the patients had COVID-19. I mean, people are getting sick with other things as well, but, COVID-19, COVID-19 definitely, is causing secondary and tertiary problems. Yeah. Third article, Kansas City area hospitals seeing record number of COVID-19 inpatients. So this is from today. The biggest hospital system in the area are all reporting record number of COVID-19 patients this past week. The St. Luke's Health System reported 149 patients of Wednesday, that's today. The University of Kansas Health System has 78 patients. Truman Medical Center has 40 patients earlier this week. This trend up is consistent everywhere. Everywhere. It's not just in Kansas City, it's everywhere. And it's going up here in Arlington. It's going up in Alexandria. It's going up in Fairfax County. It's going up in Falls Church. It's going up everywhere. Said Dr. David Wild, University of Kansas Health System. One of the only relief valves hospital have is canceling essential surgeries. So hospitals where the capacity is being filled up will start canceling necessary surgeries, like surgeries you need to live. They're going to cancel it. This could be that could be who's not going to get the open heart surgery they need today. Well, that person can die. Who's not going to get their cancer surgery that they need today. That cancer patient is going to die. Because these are essential surgeries or necessary surgeries. So you see why I, Heerak Christian Kim, candidate for U.S. Congress in Virginia's 8th District for year 2022, 2 years from now, and saying that we're going to have minimum 3 million deaths, COVID-19 deaths, by June 2021. You see why? More likely, we're going to have 30 million COVID-19 deaths by June 2021. We're going to have tens of thousands of people die in Arlington, Alexandria, Falls Church, and Fairfax County, Virginia's 8th District by June 2021. That's guaranteed. Because this is a COVID hotspot. Yeah, and we have a lot of Latinos in this area. So they're going to die. Like, a lot of Latinos are going to die. A lot of non-Latinos, whites, blacks, Asians, Koreans, Filipinos. Filipino nurses have the highest risk of death among all nurses in America. Yeah, there's going to be just a lot of people dying. Yeah, it's a serious problem right now. And we have 6 more months of the flu season to go. We're looking at months of death, months of COVID-19 deaths. I mean, we're entering a phase of COVID-19 hell for 6 months, where we're going to have multiplying deaths. We're going to have so many dead bodies from COVID-19 in Arlington that's going to make your head spin. We're going to have so many dead bodies from COVID-19 in Alexandria, it's going to make your head spin. We're going to have so many dead bodies from COVID-19 in Falls Church City, it's going to make your head spin. We're going to have so many dead bodies from COVID-19 in Fairfax County, it's going to make your head spin. Just watch. I mean, it's all predictable, right? Based on the science, based on the facts. That's coming here. We're going to have tens of thousands of people die in Virginia's 8th district by June 2021. That's guaranteed. Just watch. And I'll remind you that I said this when this happened, okay? Because I am right. I'm the Leonardo da Vinci of 21st century. I dare Dr. Fauci to tell me I'm wrong. I dare him. I dare him in public TV to tell me how say that that's wrong, that will never ever happen, that there's 100% guarantee that less than 10,000 will die in Virginia's 8th district. I dare Dr. Fauci to say this on TV in public. Because I'm 100% sure that we can have tens of thousands of people die in Virginia's 8th district. I'm 100% sure. Whether we have tens of thousands of deaths in Virginia's 8th district or not, that depends on what you do. Yeah, because COVID-19 spreads from person to person. Yeah, but I'm 100% positive that it's guaranteed that there's a possibility of tens of thousands of people dying in Virginia's 8th district, just in Virginia's 8th district, where Don Beyer is the congressman right now. But obviously I'm intending to beat him in 2 years. If he survives COVID-19, and he may die from COVID-19 before year 2022, because he's fairly old. Yeah, let's see. A lot of politicians are going to die from COVID-19 before June. A lot of politicians who are famous name. I think Joe Biden will die before June 2021 from COVID-19. That's my guess, but let's see. He has high probability of dying from COVID-19 before June 2021. Let's see if it happens or not. But that's, if I were a betting man, I would bet on that. Yeah, a lot of important politicians are going to die before June 2021. Yeah, so just keep watching this show. I'll keep you updated about what's coming. I'll give you my expert analysis as the Leonardo da Vinci of 21st century. You're very lucky that I exist in the world, that I'm giving you this analysis. Because you would be completely blind as a bat if this show did not exist. So you're luckiest person in the world. You get to watch this show and understand what's going on. Because you don't believe in the liberal media. You don't believe in the liberal media. You know that. Yeah, so I look forward to seeing you tomorrow. And I'll bring you more facts and figures that will help save you and save your children's lives. Just remember, we're heading into COVID-19 hell. COVID-19 hell. That's what we're heading into right now. Look at Harry. He's like, oh no, we're headed into COVID-19 hell. His both eyes are bloodshot red. Yeah. So I'm going to do a share because I know a lot of nurses are going to die. And I'm predicting that at least 5 from my clinical nurse leader cohort will die before 2020 Christmas. If 25 of us are all working until then, some may take a leave of absence or whatever. I'm planning to work until, I'm just going to continue to work. But I know that I can get COVID-19 and die. Obviously, I'm not an idiot. I know that that's a high risk reality. And any nurse who's working knows or should know that they have high risk of getting COVID and they could die from it. CNL 2020, yay! We graduated from master's program and clinical nurse leader from Georgetown University. You may die from COVID-19 before Christmas 2020, but you can put a Christmas wreath on your tombstone, which reads, I received master's in clinical nurse leader on August 24, 2020, yay! You gotta live with reality, right? You gotta celebrate what you have. and face the reality head on, right? Can I get a 5 on facing the reality head on? Can I get a 5? Can I get a 5 on heading heading to the reality of COVID-19 hell in the United States of America head on? Can I get a 5? Can I get a 5? Yeah. So I look forward to seeing you tomorrow, and I'll bring you many important facts and data that you need. You need to know knowledge is power, and the truth shall set you free.